Guyanese, I am Dr. Karen Gordon-Boyle, Deputy Chief Medical Officer, and I extend a warm welcome to you to today's COVID-19 update. The situation in Guyana as of the 5th of June 2020 is as follows. As of today, of the 32 tests done, there are no new cases. Our COVID-19 deaths remain at 12, and the number of confirmed cases, 153. To date, the total number of persons tested is 1,752, with the total number of negative cases being 1,599. In total, 2,528 tests have been conducted. We currently have 77 persons that have recovered, 64 active cases in institutional isolation, 3 patients in the COVID ICU, and 14 persons in institutional quarantine. My fellow Guyanese, I wish to remind you that even though there has been no new case over the past 5 days, we cannot become complacent. If we keep this up, following all guidelines, we will be on our way to limiting transmission and flattening the curve, making the return to normalcy sooner than later. I exhort you, therefore, to do the appropriate thing and let us together defy the coronavirus disease. I wish to give a shout of bravado and kudos to the rapid response, mobile unit, and surveillance teams and the staff at the National Reference Laboratory, whose coordinated efforts are allowing us to track, diagnose, and manage patients in an efficient manner. Now for the global report. According to the World Health Organization, the global statistics are as follows. The total number of cases is 6,416,828, with 382,867 deaths. In the region of the Americas, the total number of cases is 3,022,824, with 168,553 deaths. We continue to plead with the residents of regions 1, 6, 7, 8, and 9 to remain on high alert, recognizing that our neighbors, Brazil, Venezuela, and Suriname, are reporting new cases. In the last 24 hours, Brazil recorded 28,936 new cases and 1,043 deaths. Suriname now has 54 positive cases, with 1 new case in the last 24 hours. And in neighboring Venezuela, there are 157 new cases, with 1 new death. Residents of Region 7, with the new cases in Venezuela and the upsurge in your region, your vulnerability is increased. We are calling on the Tushals and other authorities to ensure that residents do not cross borders and that persons from those other countries are not entering your community. Community members must report any migrant entering your community and anyone who has signs and symptoms, and immediately bring this to the attention of the health authorities. On June 14th, 2020, World Blood Donor Day will be celebrated around the world as well as in Guyana. Earlier in our press briefings, Ms. Nataline C. Prasad, Chief Medical Technologist from the National Blood Transfusion Service, shared with you the importance of donating units of blood. I wish to take this opportunity to thank all our donors who have rallied to the cause of all those in need, and in so doing have saved countless precious lives. I also wish to make a special appeal ahead of June 14th, 2020, to all donors and to those who have never donated, that giving 1 pint of blood can save 3 lives. As this year's theme states, safe blood saves lives. The need for blood donations from voluntary donors will remain throughout the pandemic. There is a need to continually replenish the blood supply and ensure its availability for our patients. Most blood drives are being cancelled due to the COVID-19 measures, and so our supply is depleted. We continue to encourage all gynaes to utilize the services available to you and call the hotline. Make contact with the health facility nearest to you or visit one of the COVID-19 facilities if you are experiencing any symptoms of COVID-19 or if you have been in contact with someone who tested positive. We are all in this fight together. C. Curfew measures you must respect. O. Observe cough and sneeze etiquette. V. Vigilance is important for you and for me. I. Isolating when unwell is the key. And D. Distance yourself 6 feet apart to stay COVID-free. Take responsibility. Fight COVID-19 as a community and ensure your recovery. Have a great weekend. I thank you.